Hey, this is Chip Mosley at Total Motion Physical Therapy, and today we want to talk about why many of you have now come in and begun therapy in our clinic, or maybe something else you've seen online that has to do with our type of movement therapy. And you're trying to figure out, how did that work? Because it may be different from what you've been taught. So if maybe, for example, you had the shoulder problem and we gave you a leg exercise and your arm improved. Or maybe it's something where you say, I've always been taught that if I have this painful spot on me, in my leg or my back or my neck, whatever, aren't I supposed to just stretch into that pain or strengthen into that weak spot, things like that. And we actually just took you the opposite of that. We actually took you to a movement you were good at to try to fix something in a movement you were not good at. And you may have said, I recognize that just helped me, but I'm trying to figure out why. Why would we do that? Because it seems counterintuitive and seems like backward, bizarro world from what I've always taught we were supposed to do. Well, I want to kind of give you a couple illustrations here, but first of all, I want you to envision that I'm wearing a superhero costume. And again, this costume is going to be such that it's going to go over my face in a really stiff, tight mask that sticks to my skin. And it's going to go down my arm, and it's going to go all the way down my torso, all the way through my legs. And if you ever wanted me to actually put this on to illustrate this, it's not going to happen. Let's just make that clear. I'm never putting those things on. That would be a grotesque visual for you. But imagine it for the moment. But this thing that we call the costume right now, in anatomy class, we give it words. We call it skin. We call it connective tissue called fascia. We talk about how a muscle joins a tendon, joins a bone, and all these things are essentially connected together. But let's say I'm 16 years old, and I happen to fall down, and I land really hard on this hip right here. So how does the body respond to injuries? How does the body respond to impact moments? Or for that matter, if even though I was born kind of crooked on an area, what does the body do when that stuff occurs? Well, what's going to happen is it's going to create a tightness in that body to protect that injury right there. Now that tightness there, maybe there was even a pain for a few days when I had that injury when I was younger, but the pain often tends to go away after a few days. But what tends to hang around for the longer term is that tight spot. So if you imagine this tight spot on my shirt here, which I'm using as a metaphor for the superhero costume and overall our muscles, tendons, and fascia and stuff like that. Now I can have this arm that's on top of that tight hip there. And let's say right now it doesn't hurt, but let's say a couple years later, all of a sudden I'll wake up and I'm having pain in my shoulder. You may say, well, where did that come from? I actually don't remember loading rocks on a truck yesterday, so why is my shoulder starting to hurt? And maybe it's now spreading into my neck. Or maybe I had this old shoulder injury that tightened me here from years ago, and now all of a sudden I'm getting this back pain. And why is my back now hurting? Well, what's happening is that tight spot here is now creating a strain on the rest of my body. So now it may be, again, it might be a leg exercise in this example that I need to do to loosen this thing up that actually holds the secret to getting my arm and my neck happy again. So the first thing you got to understand is the whole body is connected, and because of that, one injury spot can cause pains elsewhere. This thing right here on my hip, it's going to change the alignment of my knee through my femur bone. It's going to change my foot. I could have a foot pain. I could have something thrown off in my upper neck, and now I've got headaches and vertigo or jaw issues, all stemming from this thing here. So that's one thing you have to understand. That's why we may look at the whole body, and we may do an exercise that seems like it's even far away from your injury spot in order to fix your injury spot. And that's why it could help. That's why you felt better and moved better very often after we did something like that. But what about why we would move away from the strain? So let's go back to our spot here again. Now in this example of if I was to move into that direction of my knot here on my shirt, or try to maybe pick up this leg or something like that, I'm going to see movement in that direction is going to be more strained, and it's going to be less range of motion, less strong, less flexible. So if I'm pulled in this direction, and that's causing this knot here, it's part of this knot here, if I start moving more into that direction, I'll have less range of motion, more discomfort, and less strength in that area too. But that's what we're taught to do. We're taught, hey, that looks tight. Hey, that looks weak. You know what we better do? We better work more of that. Let's stretch it out. Let's make it stronger. But if you kind of visualize what's happening in my superhero costume here, if this is pulled this way and I'm moving more in that direction, those movements basically are just pulling me more out of balance on my knot, making myself essentially more crooked, more than tighten those muscles that are adapting to those joints getting out of alignment, things like that. But when we go the other way, so maybe on this knot I lean this way, maybe I work this leg, maybe I can even work an arm in a way that's kind of pulling that knot out. That's why good movement, often away from the thing that's bad movement, can work, because it's changing all of my structure here. So if you found out earlier that we worked this arm and that arm improved, it's not that a magic juju goes from this arm to this arm. It's all going through the torso and all these other things and all these other potential knots we've had. Now imagine you've had not just that fall I had when I was younger. Now let's say I had a car accident and hurt my neck when I was 26. Let's say I fell on this arm down the stairs when I was 32. Let's say I sprained my ankle and fell and stepping in a hole when I was 46. So all of these little knots are now going to be piled on top of each other. So some of you are going to be very simple patients for us, and it just may take a few simple things to get that knot out. Other of you may be very complicated because you have all kind of history of all kind of different spots affecting you, and it may take a little more changing, and you may have a different presentation on your second week from your first week of playing this game. So just know we're not going to be teaching you how to do an exercise. We want to teach you how to address your superhero costume. How do you actually learn how to find and address and make today better? And remember, just because you change today doesn't necessarily mean it's going to accept that. If your body's now been adapted to being in this position for the last 20, 30 years, even if we pull it to a better place, you say, I felt better walking out of my therapy session, that doesn't mean your body's going to say, okay, you're different now. It's going to say, I've been used to being here, so I'm going to tighten back over there again the next day. So don't be surprised if early on in therapy you're waking up with some muscle soreness and things like that, just because your body's trying to fight those changes at first. But the secret's going to be keep making it better, keep making it better, keep making it better. The more you keep putting yourself into a balanced, flexible, getting all these knots out to our presentation, the longer you're going to feel better and the less effort it's going to take to make you keep doing that. Now I'm going to throw one other little variable in here. This is something that I believe is going to be tied to the future of a lot what we're going to see in medicine. I think actually, if we look to the future years down the road, we're going to see a lot less pharmaceuticals and a lot less chemical stuff. I think we're going to see a lot more things like nutrition being talked about and addressed. But also I think we're going to learn how much we are electromagnetic beings. So another thing that happens when I get that knot on my shirt here is that tightness there makes less electricity fire into that muscle group there through something called a muscle spindle, because if something can't move, it can't excite this nerve ending that says contract. So now I'm going to become functionally weaker here, in addition to maybe having pain and compensations because I'll move differently and things like that. So another thing that may be happening is that by moving the parts of your body that move well, they have good electricity firing on those things here. The more activity that's going, like a car battery I'm trying to jumpstart thing here, the more I see things happening here, maybe that's kind of sending some electricity into that spot there to get it moving and excited again. So again, as that pulls that tightness out by pulling the opposite direction or maybe through another part of my body to loosen that up, it also is going to get that strength better through the more firing of those things and basically healing us even electromagnetically, which I think, again, is something I think we're going to appreciate even more in the future, how important that is. So hopefully that explains a little bit why we would do that. Got to look at the whole body. Often we like to use movement you're good at to fix things you're not good at. And then again, of course, you're going to see throughout all of your treatments with us, we always are testing and retesting the problem you care about the most. Because we may have some brilliant ideas that don't work on an individual patient, and we may have some really stupid ideas that actually work really well on a given patient. But when we do test and retest, we're going to see unique to you which one of these knots being pulled in which direction seems to be the most effective at addressing the thing you care about. And if you can get the main pains feeling better first, And then secondly, you're getting my whole body of the superhero costume flexible, strong, and comfortable and not free. That's how you win the game. God bless. I hope you appreciate that. I will throw one other wrinkle out there. I'm a bit of an enigma to some people in that I'm actually a science, math, engineering guy, but I'm also a person of faith. And I often find that if you look at how the body heals when we have an injury, what the natural thing is, if I fall and hurt this leg, I naturally am going to go the other way. I'm going to limp on that other leg. If I have a disc injury over here, it'll drive me into a different posture in order to avoid that thing. So in other words, our bodies naturally moves to good posture and good movement without being told. So why does it do that? Well, I think we're fearfully and wonderfully made, and we have a body that's designed by our Creator to know what it should do to heal itself. So if you look at a lot of our therapy, how it works, pulling out these knots, we found that to be more effective than we would try it the other way over now many years of playing it on all different variables of options and directions. It happens to correlate with the way our body naturally responds to an injury. Seems to be the way that actually, if we accentuate that even more, seems to be the way our electromagnetic engineering structure called our body seems to heal the best too. Hopefully you like that. If you have any questions, let us know.